current structure from a finance perspective, from an incentives perspective, from an experience perspective, are wound way too tightly around clinical care or clinical care only, with incentives that really drive volume versus incentives that drive towards value and really a redefinition or a new definition of what health really means. And I think that's a lot of the exciting part about the opportunity. One of the things I'm particularly excited about that there's been progress in the industry, as well as in within my company, is around bundles of care. The reason why bundles are, I think, exciting and a good opportunity is they do something in healthcare that's really hard to do. They put parameters around it. It's got a clean start and a clean end. And it allows you to look at things that healthcare doesn't usually look at, things like that manufacturing has been looking at for years, things like variability. And if you can start to understand variability, then you can understand where you can drive efficiency. And when you can start to drive efficiency, you can start to get consistency of outcome. And when you can start to get consistency of outcome, you can then start to move populations of health. And so I think bundles of care provide that great opportunity within that set framework, and a framework that you can then repeat and sort of put on steroids, and just roll out condition to condition or procedure to procedure, and really start to reframe and rethink and imagine how you can deliver care in a value-based world. We have an opportunity to really shift the dynamics of healthcare from a place of helping the consumer figure out how to interact with the healthcare system to the healthcare system figuring out how to interact with the consumer. And that's a great, great dynamic and change of environment. And again, that's where I get really excited about the opportunities.